Just thinking one thing about research, which I think is super important. We'd have to remember that our research doesn't really fit into the whole Western paradigm research.
No, that's
So
not
it's a
exactly
little, well, you
true.
can't really, it's sort
If
of a
you do
line that
outcomes
needs to be.
research, you can, I was talking with Casey about this,
Mhm.
and about some post-tonsillectomy research. I tell you, in our literature, where you're gonna get sunk is if you do, you know, even 10, 15 person case study, blah, blah.
Right.
You have to set the studies up properly, because we're actually throwing away our residents' research too on people who just do a 15-person case study.
Mhm.
And so if the studies aren't set up properly, you will lose credibility. And so all of the research is going into good outcome setting. They're not case controls, but they're cohort studies. And I'd be happy to help you with that.
Right, but I'm just saying sometimes you have better results when it's not so in that.
But you're
Box,
never
though.
going to get the credibility on
Right.
our end if you don't do it this way.
And I think if we were able to combine our efforts in research, like I think our research would be probably done better if we did it in an integrated fashion. So I think, you know, as we get into hospitals and get into like UCSD and have access to more patient numbers and that, I mean, that's probably the big thing right there. And then just setting up the research in such a way that you get a good outcome.
Yeah, I agree in research, like doing it and integrating it somehow. But I think, I'm just saying, better, if we can integrate it, we get better results. And I think, we've all seen
We
great
were talking
results.
about doing,
Yeah.
I don't know where Casey is, but a post-tonsillectomy pain, you know,
Mhm.
study. And we have some parents who would not be willing, and so it'd be actually fairly easy. I have an Encinitas population of moms who are probably more open-minded than, you know,
Right,
others.
right.
You know, and set up a couple arms of the study and do it forward. But you have to set the studies up right, or people just, well, there's another, you know, Chinese medicine study, and
Yeah,
we're gonna
yeah.
frou-frou and blow
Right.
it off. So it has to be done in our language.
Right.
So somebody submitted this question. It says, do you see the double-blind control study set as the gold standard in healthcare?
No.
No, okay. Is that an obstacle or a benefit? So for integrative medicine, how do you measure balance and a shift towards balance on a global level versus a single item of vitals?
What they're called soft outcomes. And it's a lot of survey data. And in outcomes research, we're getting a lot more credibility to our survey data study on, are you feeling better? And you do, it's an ordinate variable where it's 1, 2, 3, 4, 5, and you test those variables. And so that soft data is being captured a lot better, and it's a lot more credible nowadays. And double-blinded are rarely done anymore.
Well, I will just say,